Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, and happy Friday, and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock, and with me, as always, our IT director, Mr. Ed Harrison, manning the cameras. Man, Ed, well, we made it through another week finally, and temperatures, maybe kind of that pre-spring break rise that we've been looking for. I mean, hey, look, today's not perfect, but it's not 10, 20, even 30, so look, I'm okay with it. Some cool things happening here at Southern Plains, Ed. Yeah. That's definitely worth mentioning. Last Friday, Southern Plains actually opened up its second clinic down in Pauls Valley. Dr. Susan Jones' Family Medicine Office will now join Dr. Tammy Jarvis's Family Medical Clinic, Southern Plains Medical Centers, Pauls Valley. So some cool things happening down there. Dr. Kim Jones will be here at SPMC in Chickasha doing family cosmetics. So Botox, Juvederm, fillers. We actually went over pricing this past week. He's very competitive, and of course, you know, the difference with being at Southern Plains, you can get appointments that same week. So pretty cool stuff. Ed, I know it's hard to believe, but nope, never had any work. Not a filler. Nope. Anyway, so also joining here at Southern Plains, Courtney Dahi. Hey, she's a doctorate of nursing practice, and she's going to be joining Dr. Ray Cornelison over in our dermatology department. So now dermatology appointments are available Monday through Friday, 8 a.m. to 5 p.m. And Courtney Dahi, she's just as sweet as can be and does a wonderful job over there. Also joining here in Chickasha, Cheryl Warren, and she's going to be helping out with family medicine as well as occupational medicine. And man, let me tell you, the timing on this couldn't be more perfect. Ed, last week when Angela Thayer, family quick care provider, was here, we were talking about the rampant flu, and man, let me tell you, just over this last week, it didn't slow down. Nicer temps came, but the flu hospitalizations actually continue to climb. So having Cheryl here, another family care provider that's available for appointments Monday through Friday, is huge. Again, SPMC Family Quick Care, located at 2222 West Iowa here in Chickasha, is open Monday through Thursday at 7 a.m. to 5 p.m. And again, Monday through Thursday, they're actually open over that lunch noon hour. So if you need to be seen, you're at work, you're at school, we're trying to make it to where you can come in and you're not as inconvenienced as you might be if you had to take a half day off, take a full day off, take your kid out of school. We know that's a pain, so we're trying. Hey, and then Fridays, Quick Care is open 8 a.m. to 5 p.m. You know, and it's just weird. Not as many people get sick on Fridays. I don't know. Must be something in the water on Fridays or something. But hey, our guest today actually provides our doctors and providers with the diagnostic tools that allows them to fully and accurately diagnose our patient. Lab Director Corey Couch. He's a Chickasha native, went to OU, then graduated from USAO. He runs one of the best labs in Southwest Oklahoma. It's a high complexity lab, fully CLIA-COLA certified lab. Hey, this lab is capable of running hundreds of tests to really find out what's wrong with you, Ed. Ladies and gentlemen, without further ado, Mr. Corey Couch. We'll let Ed answer that as well. Corey Couch, man, thanks so much for taking your time and coming over here. We just went over your background a little bit prior to you sitting down, and really cool medical technology and laboratory. I mean, you guys can run hundreds of labs and really help out doctors and providers by giving them the tools to do diagnosis. Man, what kind of got you into laboratory services?
Well, right out of college, I got hired on at the Oklahoma Blood Institute. Okay. I worked there for 3.5 years, and it was just a very rewarding place to work at. Yeah. One of the greatest things is when you open a Daily Oklahoman, it talked about organ sharing and how organ donor affects 5 people, 6 people, and then when you see the name of the organ donor, and like, wow. I bet. You know, I helped run the lab work on that, so you remember that day, that moment. That's just an awesome feeling. Man, that's really cool. So yeah, like one life or something, it affects 5 or 6 lives is what you're saying, especially with blood transfusions. I mean, wow, there's so much that you can do.
So after you got into Oklahoma Blood Institute. That's awesome. What a great place. They provide a lot of services. They actually come down here and do blood drives for us. They're located up in the city.
Yes.
What brought you back home? You're from Chickasha, right?
I am from Chickasha, home of the Fighting Chicks.
Right? Man, this is one of my favorite towns I've ever been in. So, really cool. You're one of the coolest people I know. What brought you back to Chickasha?
Well, I love my family. I love my kids. And I just like coaching youth sports.
Okay.
And if you want to coach youth sports, you should probably work where you live.
Yeah. In rural communities, and getting to come back home, and like you said, your family, is here, friends, and the community as a whole. It's a nice feeling to know people, to be able to help people, and you have a lot more opportunities here in a setting like Chickasha that you would up in Oklahoma City. So labs for healthcare facilities is a pretty big thing. And we're talking to you guys a little bit earlier, Corey, right before you came in, about all the labs that you can run to kind of help doctors out. And doctors rely on these lab tests to fully diagnose patients. How many labs or tests can you guys run over in your lab?
We can test for just over 65 analytes and organisms. So we have a really broad test menu.
Okay, wow. So broad lights and what?
Analytes and organisms. Analytes might be your CMP, your chemistries, and organisms maybe, I use that loosely, as far as viruses such as flu A, flu B, strep.
Man, that's awesome. And those are big tests right now. Of course, the flu's just been running rampant. More than 1,777 people in Oklahoma have been hospitalized due to the flu. So you guys see this all the time. But you guys see it, what, does it come over in blood? So how do they test for the flu?
The flu, what we do is we do a nose swab.
Okay.
And they bring it in, twirl it.
Oh.
And then from there we got a rapid test, and in 10 minutes we have an answer for you.
In 10 minutes?
10 minutes.
Man. Now you want to talk about life-saving, and I know, sometimes people might say that's dramatic, but 1,700 people have gone to the hospital, 58 people in Oklahoma have died because of the flu, and if you get diagnosed and you know that you have the flu within 10 minutes, that allows the doctor to give you something that is going to heal you. That's awesome. So you don't even have to draw blood. You don't have to do anything to test for the flu. Just a swab on the nose?
That is correct.
Man, that is cool. That is too cool. So I wanted to touch back because your lab is kind of one of the things that separates Southern Plains. And so I've kind of been waiting for you to come on the show because I think a lot of people don't realize what all you do for a facility. So, for instance, one of those like doc in the boxes or like an urgent care, small, one doctor clinic, one nurse practitioner on the corner, they're not going to have the capabilities to run the labs that you do, right?
So what makes us unique as a high complexity laboratory is that we have such a broad test menu. So if your symptoms don't quite fit the traditional flu symptoms, a doctor can look at your iron levels, they can look at your thyroid, they can look at your CBC, and a CBC is a very good diagnostic test in that they can look at your white count. Is it elevated? It would mean bacterial. Is it decreased, which could mean viral? They can look at your eosinophils, which yells out, hey, we have allergies. And
so there could be some misdiagnosis in some other labs where it could be something viral or it could have just been allergies.
Correct.
And somebody might have misdiagnosed that problem, but with your test, you can actually kind of dive in and separate them a little bit.
They just have a better test options.
Okay.
And then let's say they do have a white count. Why is the white count high? If they do a urinalysis, we can look at it and then put the urine under the microscope. We see lots of white cells, lots of bacteria. It's obvious it's UTI. Or if they're having certain pains, if we see red cells under the microscope, maybe they got early onset of kidney stones.
Wow. Man, you guys can really help a lot of people. I mean, this is like preventative measures. So in that, I think a lot of people get cheated or maybe not. They go to their doctor up in Oklahoma City and they might not have the high complexity, the ability, the tools, the equipment's expensive. Now, that would be something I want to know if I have kidney stones, and I would want to know now. So, I mean, if my doctor didn't have that capability, but I wanted to see that doctor, could I come and get that lab test from you and then go back to that doctor?
If a person is seeing a doctor, let's say in Oklahoma City or outside of our facility, absolutely they can have their labs done. And we'll come across people that's been driving back and forth the city for the last 4 or 5 years, and there's like, I didn't know I could have that done locally. So if you need your test done locally, all you got to do is bring a script from your doctor or have them fax us the script. We'll run the tests and then have it faxed to the results faxed to the doctor.
How convenient, because a lot of people might not know. I didn't until I started working here, but some of the labs, like fasting labs, you're not going to do that same day. So let's say I drove from here to Oklahoma City, a full hour drive, see my doctor. Well, I'm going to have to come back home, not eat for 24 hours, 12 hours, whatever, and then drive back to Oklahoma City just for a lab. And all the while, I could have just done that here. You would have faxed the labs. They would have got it. That's outstanding, brother. Great service. So kind of a continuation to that question. So maybe some small doctor's offices that we were talking about, they don't have the high complexity. They don't have the labs. Can you help those doctor's offices, or like a senior living facility? Could we partner with those facilities and help them with labs?
Absolutely. We can, and we have done so.
Okay.
And so if we need to send a phlebotomist to collect the blood and bring it back here, we can.
Wow.
And we can have your results in less than an hour.
Less than an hour?
Yes, sir.
Bro, that is full service. So you're going to send a phlebotomist, be able to draw it, bring the sample back, analyze it, all within an hour, and you can get it back to that facility?
Absolutely.
That is too cool. That is some good service. And I think it's a big service to have here in a rural community, to have here in Chickasha. I mean, we're special. We're lucky. It's a great career option as well. Can you tell us about some of the positions and opportunities that might be available for some of our youth in lab?
We've always loved to help develop the VOTEC students. So we've had a lot of VOTEC students from Chickasha and as well as from Fort Cobb come here and do their clinical rotation.
Man, that is cool. Well, and then afterwards, I mean, there's so many healthcare facilities in Oklahoma, and all of them need labs, phlebotomy drawn, because that's how you diagnose a patient. So there's tons of job options, and to me, when I was growing up, all I wanted to do was play baseball, right? And so I went to college. I had no idea anything about healthcare.
Well, if you want a career in laboratory, you can be as simple as a 2-year degree. Rose State, just right up the road,
okay,
in Midwest City, offers a 2-year degree of medical laboratory technologist. And I went a different route. There's not a whole lot of local places if you have a 4-year degree and want to become a med tech. But if anybody's any questions, call Southern Plains, ask for Corey Couch, and I'm more than happy to help you.
Man, that's so cool. And he's always more than able to help anybody. I mean, he's just the nicest guy in the world. If you're from Chickasha and you know Corey, you know that about him. He'll just bend over backwards to help anybody out. You do so much for this community and so much behind the scenes. And, you know, I'm so interested in you outside with softball. You do great in coaching your kids' sports teams, man. It's a pleasure to have you here at Southern Plains. We're very lucky, brother. Thank you, Hal. It's a pleasure to work here. It's been very fulfilling and rewarding. Cool. Well, thanks for coming, man. Thanks, sir. You want to do that? Hey, thanks so much for watching, and come back next Friday here on our Facebook page or over on our YouTube channel for our podcast, Your Hometown Medical Minute. Have a great weekend.